David.
Okay, that's great, thanks. Yeah, What Works for the Poorest? It's a somewhat different book. It's broader, and it's got 4 editors, and about 30 different authors went into it. And when you've sent a book off to a publisher about 10 months ago and haven't looked at it since, then you do, when you think, I'm going to launch this tomorrow, think, I wonder what that book is like. Luckily, when I looked at it again yesterday, I'll have to let Paul comment on this. I don't want to prejudge his comments, but I was very pleased with what we'd actually come up with here. The book has its origins in conversations that I and colleagues in Bangladesh and the Chronic Poverty Research Centre researchers and researchers, particularly at BRAC in their Research and Evaluation department, were having 4, 5, even 6 years ago. These were discussions about amongst a lot of us who'd been working in Bangladesh for many years, and were very much aware that microfinance, which has worked very well in many parts of Bangladesh, for many people in Bangladesh, for some objectives in Bangladesh, that all of us who worked in the field knew that even the best microfinance programs only get so far down. They only tend to work with energetic and dynamic poor people in the right locations who get on well with field staff. And we'd known that for many years. And we were sometimes getting irritated with Professor Yunus before his Nobel Prize going around the world saying that microfinance reaches the poorest of the poor. No, it works very well for certain types of poor people when it's well done. And through these conversations BRAC had started off a program called Targeting the Ultra Poor, and that was actually trying to get to people who were seen as non-eligible for microfinance, who field staff didn't want to work with, who the programs couldn't work with well. And so BRAC was working on trying to work out how it could reach people who were living in extreme poverty, extreme income poverty, but usually people who weren't getting access to education or health services, usually people who were seen as somehow socially stigmatized and or living in areas that were not close to the road or fairly hard to get to. And sort of out of that, my colleagues Imran Matin, Karen Moore and David Lawson, those conversations took us to think that we should pull together what was happening in Bangladesh with activities trying to reach the poorest, and also what was happening more broadly in international experience. So the book itself has those very sort of practical origins, and it is very practical and action-oriented. It touches on theory to a degree, but it's not intended to make a particular contribution. It's meant to motivate people, hopefully, to think about how they might design programs for those who programs don't usually reach. If there is a theory behind it, and it comes through quite a few of the papers, and it is that the growth is definitely not enough, even when growth is running at these phenomenal rates of 6% per annum for the last 15 years in Bangladesh, 10, 11, 12% in China and India, similarly high rates in Vietnam. Even in these contexts, large numbers of people are poor, and significant numbers of people are receiving virtually no benefits at all from the enormous expansion that's occurring in the economy. We've still got, perhaps around 1.5 billion people living in extreme income poverty, 1 billion people hungry at the moment. The figure's gone up by 100 to 150 million since early 2008, and the increase in food price rises. And this demands other forms of intervention. And in our foreword that Ravi Kamba, who did the World Development Report 2000, he kindly wrote the foreword there, and he sort of pointed out this case that there have to be other interventions. It may be that it's hard to help poor people when there's not growth, but even when you've got phenomenal growth, there are significant proportions of a population that may be receiving no benefits, or that may actually be finding that their life is made worse, particularly when forms of employment are actually adversely incorporating people into the economy, whether that's through leather tanneries, through rickshaw pulling, but quite a number of the forms of informal employment, sex work, for example, that are created in growing economies, actually may be damaging people's health and stopping them from achieving their rights. So we started looking at these things. We set 3 objectives for the book. One was to raise awareness, to get policymakers and also NGOs, social activists, to make sure that they were looking at all the different types of poor people, and particularly those who were very difficult to access, very difficult to get information about. We argue in the book there's a priority need for this, partly for ethical reasons, because people who are extremely poor suffer greatly, partly because this is particularly associated with the intergenerational transmission of poverty. Extremely poor people are not able to invest in their children, and so their children are not adequately nourished or educated, and often do not reach their full height or are able to develop their cognitive abilities, and also because of the extremely high mortality rates that those who are very poor face. Legally, then, we can argue, and constitutionally, that in many contexts these people are denied virtually all of their human rights. The second objective was to encourage the collection of data, the identification of who the extreme poor were, those people who we knew very little about, and then to promote policies and projects to try and assist extremely poor people to escape the problems that they faced. And then finally in the book, and about half of the book is devoted to providing practical examples where there are projects and policies that are trying to reach people who public policy and private action through economic growth are not assisting to improve their lives. Some practical examples of that. Those are meant for learning, certainly not for transfer, but hopefully for learning so that people can look at those, and also for inspiration and motivation, that one can actually see examples of some of these programs that have worked highly effectively, and that will encourage people to think, well, no, we could actually work with groups that are further out in remote rural areas, or groups that appear to be very difficult to access because there are intermediaries who are trying to control them, perhaps keep them virtually in slave-like conditions. Let's give you a rapid outline of sort of what's covered in the book. The first part of the book looks at creating knowledge, and we think that's really important. Extremely important, because often when you talk about very poor people, then the image that most policymakers have is of the classic extremely poor, of orphans, of widows, of disabled people, of the frail and elderly. Sometimes that is the case, perhaps for 10 to 20% of those who might be regarded as economically and socially extremely poor within a country. But generally the majority of people who live in extreme poverty are actually working. Quite commonly they're working excessively long days, 9, 10, 11, 12, 13, 14, 15, 16 hours a day. But the rates of remuneration that they have, or the expenses that they have to meet to access that work, mean that virtually nothing is left, and that they are extremely lowly paid. And certainly some of the cases that are looked at in the book look at a Ugandan woman, an old woman living in a remote rural area, who gleans coffee. After the coffee has been picked, then she goes up the steep hills where the coffee grows, picking the coffee beans that have been missed out. And when you value that work, it's round about 2 to 3 cents an hour if she's lucky. And that's the coffee that we buy, because that coffee is actually traded out of the country. Rickshaw pullers in Bangladesh are a job that many young men like when they leave the rural areas and move into the city. It seems a good job at first, but when you chart the lives of rickshaw pullers, you find that steadily they reduce the number of hours that they pull the rickshaw, because the time they're getting into their 40s, their bodies are so tired and they're suffering so much pain, their backs are usually broken by it, their lungs are beginning to congest with the diesel fumes, and usually they have an early mortality, often with many health problems at the end of their lives, and that actually mining the human capital that we've got. So it's very important to create knowledge about the different types of people who experience extreme poverty, and about the different causes that may cause that. And in the book we look at quantitative ways that can be done with panel data sets. We look at Q-squared approaches, how quantitative and qualitative methods can be combined so that one can get a deeper understanding and identify and then understand why people are in poverty. And also look at contrasting measures. An interesting paper by Naila Kabir that looks at income measurements of extreme poverty and food security measures, and finds that the food security measures are much easier to use, both for research but also in the field if you're trying to help people, and that they're actually a much more effective way of identifying people who are facing extreme problems. Another section of the book looks at targeting, because commonly when one is looking at these schemes, there are very limited funds available for them, even when donors such as DFID, such as AusAid, the Australian Agency for International Development, that are getting interested in programs that try to go deeper and reach the poor that nobody else can reach, often the funds are limited. And so we have a series of papers that look at the different indicators that can be used to rapidly select people in the program. There's a paper by Francisco Ayala about the design of social protection schemes that try to reach the poorest people in Kenya, and also from Hilary Standing, a paper looking at how you could try to get health services targeted on people who've got virtually zero access to health services. The largest part of the book then looks at case studies, and it looks at a whole number of case studies. One of them is Chile Solidario, but Chile has decided that it is going to try to, now it's wanted to reach middle income status, that it would try to eradicate poverty. And Chile Solidario takes a broad-based, multidimensional approach to trying to eradicate poverty, a very interesting program. We've got a case study of the program that I and colleagues at Manchester work on, the Targeting the Ultra-Poor program in Bangladesh, which provides people with small cash transfers. After a while, it provides them with an asset, 2 cows, a cow and 2 goats, those sorts of things, and then it provides them support, social support and business advice, so that at the end of 2 years, most of the people who get this particular package of services have significantly increased their asset base and their income, and are able to move on to joining microfinance groups, women's groups, and the other activities that NGOs are involved in. Cash transfers in Vietnam, an Oxfam program, a whole set of other programs that look at how one might get health services or services that could improve poor people's incomes down to them. The final part looks at how we can actually make these programs work, and that looks particularly at how you can spread the knowledge and information, and it points out now that we've got a substantial knowledge base on this, particularly the work that's been done by Syed Hashimi and other colleagues in Bangladesh, who've been doing a comparative international study of ultra-poor programs and actually generating a set of knowledge about those. And it also looks at the question of finance. Is the money there? And Tony Addison, who does a paper, argues that even in low-income countries, there are budgets, limited budgets that could be found, and that we can get aid donors to use their resources more effectively in these programs. What are the key messages? Well, there are many messages in the book, and as Joe was pointing out earlier on, we find that context is incredibly important. One can try to, in a way, transfer knowledge and transfer ideas, look at learning, but certainly transferring programs, reproducing programs is something that needs to be treated with great caution, because contexts are incredibly important. Important in terms of the types of people who are living in extreme poverty, the processes around that, and the types of services that are or are not reaching them from NGOs, from the government, and from private sector actors. But when we try to bring it down to some messages, then one of them is about growth, and the fact that we're still being conned about growth. We were told about pro-poor growth, but whenever anybody quotes a growth figure to you, it's an aggregate growth figure. It's not conditioned to show whether that growth is improving the poor. It's just assumed that the bigger the figure is, the better it's going to be for the poor. The sorts of arguments that were made by Dollar and Cray and others around 2000. We know that's not the case. We know that growth works differently in different contexts. Sometimes it can be quite pro-poor. At other times, it goes into the top 20 to 40% of the population. And so we've got a fairly simple recommendation about that. If you're thinking about the poorest, then what you want to know is what is the income growth of the bottom quintile. And that can usually be pulled out of national statistics. So look at what the growth is of incomes for the bottom quintile of the population, not for the economy overall. And commonly you will find that the income growth of the bottom quintile is way, way below what is quoted as the national figure. And at least then we can say, well, is there something that can be done about this? Can't this growth be more broad-based? Can't taxes be used to invest in infrastructure in areas that are not well connected to the economy, where poor people are concentrated? Can we promote agriculture? Can we put some of the resources into cash transfers so that we can begin to help people work out how they want to use these resources? The second set of messages is about social protection. I think Joe has gone through those in great detail and given us a great idea about those. Those can help on the number of fronts. They reduce vulnerability, they increase income, they improve nutrition, improved human capital, they can add to productivity, and even some evidence indicating that they may be able to contribute to sort of social cohesion, maybe even political stability in the longer term. The third message is about service delivery and about how services might be delivered more effectively. This is an area that we found particularly hard to come up with generalizations on, but certainly a number of messages do come out. One of them is the incredible importance of basic health services, of immunization, of access to clean water, of access to services for the top 3 or 4 diseases, for malaria, for TB, HIV/AIDS in some cases. But most extremely poor people find that ill health is a major part both of the experience of being extremely poor and of not being able to escape poverty. Other things need to be done, often broader policies such as tackling discrimination so that services get through to people, removing user fees. User fees are one of the most effective ways of making sure that very poor people don't get education services or health services. They need to be abolished. A variety of forms of innovation in service delivery are described in the book. And also we go back to this idea of just breaking down public expenditure by quintiles. If you break down health expenditures by quintiles, you find almost all the time that the wealthiest 40% are getting 3, 4, 5 times as much per capita as the poorest 20%. And actually, in a way, there are subsidies quite often from the VAT that very poor people pay that are transferred to the wealthiest people through public expenditure. Keep asking, why is it like that? Should it be like that? So, conclude then. Basically, a couple of points. Well, three points. The point about context again. I mean, we do say, look at these ideas, but they need lots of local knowledge and understanding and experimentation. They need a lot of unsung heroes. You need to be able to get field staff who are committed to working with people who are not easily accessed, who live in difficult environments, sometimes remote rural environments, sometimes urban environments that are very badly contaminated and polluted, and field staff have to be prepared to work and risk their own health and their own well-being in those situations. And we often find that field workers need to have, in a way, social work skills, not the skills often associated with microfinance or agricultural extension, about disciplining people and making people what you do, but understanding just the complexity of very poor people's lives and how many different fronts they have to work on just to get up each morning and to be able to function. But the final point has to be, I think, one that came out again in Joe's points about cash transfers, the agency of the poorest. There is this idea, particularly amongst policymakers and elites in developing countries, that very poor people are dependent and would need charity. That's not the way it is. They are not passive, they are not dependent. They are struggling and strategizing with next to no resources in excessively difficult environments to improve their lives and to improve the lives of their children. And so we have to look at how we can assist them so that they can pursue the strategies that will help them improve their lives and take their children's lives forward. Thank you.